Management of polycystic ovarian syndrome can often become quite problematic because the underlying issues are in many cases not addressed. The underlying issues that can drive polycystic ovarian syndrome, two main ones that we want to talk about today, hyperandrogegism and insulin resistance. Both of these two conditions that can be present on a biochemical level actually drive majority of the polycystic ovarian syndrome symptoms, such as missing cycles, increased hair growth, hair loss on the scalp, changes in metabolic health, potential weight gain, sugar cravings, and both the hyperandrogenism and insulin resistance are actually closely connected, where one can worsen the other. So it creates kind of this negative relationship between the two, which can worsen polycystic ovarian syndrome symptoms. So often when we're managing PCOS for patients, we start to look at these underlying issues, especially for patients that have tried different treatments but really haven't felt better. They still feel fatigued, they still feel tired, they're not getting that relief of those problematic symptoms that they're looking for. And this is where testing for the biochemical issues actually helps us in two ways. Number one, I find it really helps us to identify what's going on with each individual patient, because no two PCOS patients are alike, and each one has their unique needs, healthcare needs. And once we know what those are, our treatment can be much more personalized and focused on them. And that way, usually we get better results. We see patients that are feeling better much quicker. So hyperandrogenism and insulin resistance, while they're quite common with PCOS, may not be present in 100% of patients that have this condition. I think it's estimated in some of these newer studies that insulin resistance affects somewhere between 50 to 60% of patients that have PCOS, and hyperandrogenism, a similar number, somewhere 60 to 70%, or even potentially higher in some of those studies. So while it's present in not all cases, it does make up a large portion and majority of PCOS cases. So quercetin is this wonderful compound that's actually found in various foods, vegetables, and is actually the main ingredient in a lot of botanical medicines, especially traditional Chinese medicinal herbs as well. And quercetin is what we call a polyphenolic compound, and polyphenols in general are very strong antioxidants. In addition to that antioxidant purpose and effect, quercetin has actually been studied to have certain effects for PCOS. And while the research is limited, we're seeing some clinical studies now that have suggested taking quercetin for upwards of 12 weeks was actually found to normalize or help improve some of those elevated androgens, namely testosterone and luteinizing hormone. So testosterone is produced in the ovary with PCOS, or the adrenal gland, and luteinizing hormones produced from the pituitary gland in the brain. So both of these hormones can drive anovulation and other of those symptoms that we covered earlier with PCOS. So quercetin was actually found to help reduce both of those hormones, and the results were statistically significant, and we didn't see that same impact in patients who used a placebo in those clinical studies. So there's a potential role for quercetin in helping with the androgen levels, and it should be very transparent that the studies here that we're talking about are very limited, and we do need larger quality studies, higher powered studies to confirm these findings. But it is exciting to see how certain compounds that have namely very high safety profiles, may actually have such a pivotal or significant role in treating PCOS. The second thing they found was it may actually be beneficial in reducing insulin resistance. So there are some studies now that suggested taking quercetin was actually able to improve the signaling of something called adiponectin. Adiponectin is a hormone that's produced in the body that has two purposes. Number one, help to reduce insulin resistance, and number two, to reduce inflammation. And while we didn't mention this earlier, increased inflammation is also one of the underlying factors that can worsen and drive polycystic ovarian syndrome for a subgroup of patients with the condition. So adiponectin has this important double role that may help with PCOS. However, the studies we're seeing, they showed an improvement in the fasting blood sugar, insulin levels, and insulin sensitivity, but it didn't reach what we call statistical significance. So it's still a big question mark. Can it actually help with insulin resistance or not? And again, the researchers in these reviews are recommending higher quality studies and larger studies. So And all the information we're sharing here is really for educational purposes. So always speak with your healthcare provider before starting any treatment so they can check to make sure A, it's safe for you, 2, it's not going to interact with your current medications or treatment plans, and 3, what an appropriate dose and treatment timeline would look like for you.